Welcome back. We are trying to combat fear with facts. That's the goal of this new section of KSAT News at 9, dedicated to talking to experts about things you need to know about. Tonight, we're speaking with Dr. Robert A. Frolichstein, an emergency room doctor working right here in San Antonio. He actually joins us from Methodist Hospital. Doctor, thank you for joining us tonight.
My pleasure. Thanks for having me on.
Talk about what the ER is like since this crisis. Have things changed dramatically in the ER where you work?
I would say the volume of patients has dropped a little bit. I guess that's the social distancing thing kicking in, and we're glad of that because the last several weeks has been just filled with lots and lots of preparations, and it's really encouraging to watch the physicians and the team at the hospitals pulling together in preparing for what we're about to face.
Yeah, and I don't want to go any farther without thanking you and your staff and all the healthcare workers out there for all that you're doing and all that you will be doing over the coming weeks. So thank you.
You're welcome.
The first viewer question tonight is, should I go to the ER if I think I have the coronavirus?
Well, that depends. Anytime you think you're critically ill and you're really struggling to breathe or anything where you're critically ill, certainly call 911 or come into the emergency department. If you're doing okay, you just feel sick and you're a little worried you might have the virus, what we're asking, and this is a unique thing, but we are asking people to call their doctor, or our group has established a telemedicine program where you can contact one of the emergency physicians and talk to them about whether you really need to come to the emergency department.
Do you have the tests there? Do you have the capability in the ER to do the COVID-19 tests?
So we do have some testing capability. As you know, testing has been severely limited across the nation. It's encouraging to know San Antonio Metro Health Department has some tests. Currently, our testing capability is really limited to patients that need to be admitted to the hospital.
Is that frustrating to you as a doctor that you can't give as many tests as you would like to give, I'm guessing?
Sure. Yes. I think I would love to test lots and lots of people. Other countries had a great capacity to test people, and it really made a difference and helped flatten the curve. You find that once a person knows they have the illness, they are much more likely to do the quarantining, social distancing things that are needed.
When you know you have a patient that has a fever, do you change? I mean, are you putting on gloves? Are you putting on a face mask? I mean, for you physically, what are you doing to protect yourself and the people you work with?
Yeah, the processes at Methodist hospitals are that the patients are screened early on, and any that have any respiratory symptoms, fever. We used to ask about travel. That's becoming more irrelevant. They are considered to be potentially a person under investigation for COVID. And yes, our approach to them is different. We wear a mask and gowns and gloves to protect ourselves potentially from becoming ill.
Have you ever done anything like this before? Have you ever had a situation where you've had to approach it with this much caution, I guess I would say?
Well, back in, I think it was 2009 when the H1N1 was big, we certainly had some of that. I don't recall it feeling the same as this does right now.
Yeah. Okay, let's get to our next viewer question. This person says they're a dental hygienist. Their office is not closing. Are they putting themselves and the general public at increased risk by continuing to treat patients?
Most of the offices, dental offices, physician offices that I'm aware of that are staying open are doing a good job of screening before the patients come into the office. And really, as we know the virus right now, if you're not having symptoms, that's probably a safe thing to do, and I'm sure they're taking the necessary precautions.
The next question is, how can I get tested for COVID-19? I mean, you can't just go out and get a COVID-19 test.
That is correct. There is, again, limited testing availability through the San Antonio Metropolitan Health District, and there are some private labs that offer testing. But again, it's for very specific patients that are symptomatic, that have a flu-like illness. And your best bet to obtain that is to see your personal physician, or if you don't have one, we do have the ability to see you via telemedicine, and if necessary and if it makes sense, we can order or at least refer you to the San Antonio Metropolitan Health District to get evaluated for testing.
When you say if it makes sense, I mean, what are the things that you're looking for that you're going to say, okay, this person needs to be tested, or yeah, I just don't have the feeling like, like maybe it's allergies or something else?
Well, you bring up a good point, because this is cold and flu season, and we're in the midst of some flu and a lot of colds, and this COVID is just like any other viral illness, and so it's very hard to distinguish that on a clinical basis. The real need to test, again, is from a public health perspective, and so as many people we can test, the better off we are. But again, currently, because of the restrictions, there's pretty specific recommendations on who gets tested. It makes sense to me that if you share a home with someone who has some chronic illnesses, it would be very good to know if you had the COVID virus.
I talked to a doctor today who told me that it basically comes down to his clinical judgment, whether or not he thinks somebody should be tested or not. But he also expressed some frustration in some of the private laboratories out there that are doing the testing, that it's taking a long time to get those tests back. Have you experienced any of that?
Yes, I think that turnaround time is pretty variable, but some of the private labs are 2, 3, 4, 5 days sometimes, and it's just simply a volume thing. I think they're getting inundated, and it takes, I don't know how long it takes to actually run the test, but it's just when you have so many tests that it creates a backlog.
What's your final, I'll give you the last word here. What would you say to the average San Antonian, average person in Bexar County, South Texas out there that is concerned right now about COVID-19?
Take this social distancing thing seriously. And it's very inconvenient to be in your home and the restaurants are not open and all that, but it is what will save lives. That is what will flatten the curve, as they say, and that just means that if we have so many cases at one time, it will overwhelm the capabilities of the healthcare system to take care of those people and other people that will become ill with the regular things we see every day. If you have a heart attack or appendicitis and the healthcare system is overloaded, that's going to have an impact on your care for those other illnesses as well. So take the social distancing theory seriously. It's really your chance to help save lives.
Very well said. Dr. Robert A. Frolichstein, thank you very much for joining us. Have a great weekend, and I know you're just starting your shift, so I thank you for taking time out to help us tonight.
Well, thank you.
All right, take care.
Appreciate it.